can leave all of these mics hot. Thank you.
Thank you that you are here. I want to thank especially Dr. Bob Sataloff and his marvelous group because of the very welcome that they made to Collegium Medicorum Theatri 50th anniversary. So, as you well know, Collegium Medicorum Theatri is an association that is celebrating this year 50 years of existence. Our existence is due to many of our dear members like Dr. Wood, Dr. Hans Verleden, Dr. Tarasco, and of course all the members who were founders in Mexico City. So I am also very honored as a Mexican to be the president of Collegium Medicorum Theatri. But we cannot forget that Collegium Medicorum Theatri has been all years, during 50 years, been joining all over the world to celebrate the artistic voice. And many of our dear members are not with us in presence, but in our thinking, in our emotions, and in our spirit. And of course, they're having all over the world these wonderful meetings, and we are very happy to celebrate here with Voice Foundation our first celebration of these years. We are having more celebrations with our dear friends in Ravenna, Italy, in Florence, Italy, in Copenhagen, Denmark, and in Argentina. And well, all the members that are present and not present are very well-known personalities working daily with artistic voice and dealing with so many matters of artistic voice. So we are going to make this roundtable in honor of artistic voice and in honor of all the members of Collegium Medicorum Theatri that made it possible to be here with you 50 years. And in Collegium Medicorum Theatri, we joined many medical doctors, but also scientists, voice coaches, singing singers, voice singing teachers that are dealing daily in all the edges of the artistic voice with singers, actors, and of course with everybody who has an artistic voice. So may I introduce Dr. Orietta Calzinoni from Milan. She is working in La Scala, and she's also working in many interesting international and Italian projects. Dr. Bob Sataloff, he doesn't need any presentation, but I would like to say he is one of the heads of this Collegium Medicorum Theatri also. And Dr. Joseph Schlomicher is our secretary, general secretary from Collegium Medicorum Theatri, and Dr. Pibu is one of our many distinguished members. So the first case is going to be a mezzo-soprano, 25 years old. She's a pop singer. She has been doing 15 concerts in 2 months, but she has dysphonia during 1 year. And she has to cancel, after these 2 months, she has to cancel her journey. As medical situation, she has a nose deviation septum, hypertrophic turbinates, reflux only in the morning, and she has a small overweight of 10%, but only 1 year of singing lessons. And here is the stroboscopical. As you know, we have to change to many formats, so I hope you have clear these images in the stroboscopy. So I would give the presentation first to Dr. Orietta. So what would you think in this mezzo-soprano, only with 1 year singing lessons, and if she, as a pop singer, is working so hard but without a really technician development?
I would ask her if, besides singing lessons, indeed a short period, she was trained how to cope with such a tough schedule, because it's not only know how to sing your pieces, but also how to bear the vocal fatigue because of the many performances altogether to support. This may enhance and reveal some hidden lesions in your voice that you may better cope with more intervals between performances. Usually people with small lesion may, if not bearing their support, their body support, may fail in tightening of skin.
Thank you very much. And Dr. Sadalov, I would ask you if you could please also tell what do you think about the reflux and the hypertonic turbinates together in a singer without not so much technique?
I think they both need to be addressed. It may be that the hyperturbinates are allergy, but it also may be that they're from reflux. Reflux, as we all know, can get high. It's been identified in middle ear fluid. It can cause sinusitis. So if there really is reflux, it should be treated in conjunction with nasal treatment, and I would routine the allergy test. A person like this as well. I agree with the other comments. There are lots of things that need to be asked about here. What kind of, if it's screaming pop or clear sound pop, if you can monitor speakers and lots of other things. But the real issue here is what we're seeing in the stroke.
And would you advise immediately to take some medicines for both problems?
Well, I do a workup for both problems very promptly. If she hadn't taken anything that prevented it, I would allergy test her the same day. Depending on how compliant I thought she would be, I would either start her on reflux medications immediately or get a 24-hour PHP study within the week, and then start her while I was waiting for results. But yes, I would treat her, and most importantly, I would put her in with my voice team immediately, both for speech and for singing. Although it is very likely that she's going to need surgery, and with not just the mass, but the previous hemorrhage and the indented scar on the right vocal fold, it's unlikely that she's going to get a perfect result. But depending on what kind of music she sings, that might not matter.
Mm-hmm. Thank you. And Dr. Pico, do you think it could be possible to make when the surgery? Because as Dr. Sadalov said, this is a singer that it is most probably that she goes under for no surgery. But what would you advise? Because she is on a tournée, she has to cancel, but you know the stroboscopy that we have.
If this is the first time you're seeing this person, I think she is only telling you that she needs some sort of intervention. And the intervention depends on the cause, which I think is I think we can all agree is most likely multifactorial. So our challenge, at least in the short term, is to figure out the most efficient way to get her to a resolution of her situation so that she can then proceed. I am not as sanguine about saying, oh, this person for sure will need surgery at this point. And I would say we need a couple of months, maybe 6-8 weeks, in order to be more defined in terms of understanding which aspects can be intervened on. The first 6 weeks, if she cannot tolerate that type of a distribution, then we are then trying to satisfy her needs as best we can. So if you said, well, what type of surgery would I do if she has failed all the other components that we would like to do from a diagnostic point of view, I think, to me, this is something that it would be quite amenable to monomitral surgery.
Thank you, and I agree completely. I didn't say she needed surgery, I said she probably needs surgery.
Yeah.
But the other thing is, you made it easy for us because she had already canceled her tour. The patients who are really challenged are the ones who come in with exactly the same situation and say, I can't cancel my tour, I have a concert tonight.
Yes, and Dr. Schrödinger here, he is working with the Salzburg Festival, and he has a lot of cases that have to be very quickly, well, let's say, treated in order to have more performances, but also all the medical group and of course the therapeutical group, including the voice coaches, they are under pressure from the producer because there is a lot of money going away. And so what would you recommend? How long could you wait? Because as Dr. Sakalov said, the tournée is already on the way.
To compare that lady, the pop singing lady, with a light singer at the Southern Festival, there's a difference. She has the chance to sing with the microphone. She has the chance to sing a special style. Not she can at pop singing a little bit wholesomeness is allowed. This is a good sound. I will help her to make a quick change of her lifestyle and dietary advices. The next thing, I'm a reflux thinker. I give her reflux medication. Then I make a rebuilding of the vocal cord with semi-occluded vocal tract therapy. It works very well. And she should stop singing for 3 weeks and try to change some concerts. And then I believe she can sing with that. And then we have to wait what happened. When she is following my advices for the next 3-6 months, she has a chance to overcome that. Maybe there is some pseudocyst little bit left on both sides or on one side. Maybe she can sing with that. And then we have to decide if it's necessary to do operation for the future, yes or no.
Well, what I think, thank you, Doctor. What I think is that, as the panelist said, we have to wait, but not too long. In my opinion, we would give a very, very intensive treatment, of course, allergy test, and also to see what's happening with the esophagus, if she has some infection from Helicobacter pylori, because sometimes we do not think because the patient is not complaining about that, but we have to think about that. And also, either endoscopy of the esophagus, if she has had some story before, or X-ray to see how it's functioning. But I would only wait because she's on tournée, only 10 days, and then immediately we decide according to the results. If the results are very good and the inflammation is away and almost 50% of the degeneration of the vocal, of the free vocal edge is gone, then we can go on with voice therapy. Would you advise somewhat other exercises or only semi-occluded vocal exercises, Dr. Orienta?
No, I would
After 10 days.
Yeah, I would add also a specific voice therapy, vocal coaching and voice therapy expert. But I would underline also that if we, as Dr. Sata will suggest, and if we take advantage of these few days, we may also help her to rebuild her schedule, because many times before tour, in pop singers, there is all the preparation of the record, and that might have been the worst period in voice for her. And so we might get advantage of just a short delay to reprogramming of the canceled data. And that's important in show business. So, of course, she needs a thorough help and multi in a team, a voice team for help her now, but also to project a future in the short time. And to decide if maybe say something of a tour or it's time for surgery.
Yes, Dr.
I'd like to talk a little bit with the panel about long-term surgical decision-making. short term, I would almost never operate on somebody like this in the first 6 to 8 weeks until the field had been optimized by the voice therapy team, the reflux treatment, and allergy, and everything else. Things are going to come back. But let's say that in 8 weeks she's singing adequately for her purposes. What do we follow and how do we make surgical decisions long term? And my answer is looking 2 places. And probably everybody remembers, so you don't have to play it again. But her right vocal fold is concave to deep to the mass, stiff and scarred. So she can't afford increasing scar on that side, but more importantly, she can't afford to develop a mass with scar on the other side. So when I leave these people alone and don't operate on them, I watch them very closely, and my primary decision is made by the presence of increasing fibrosis and increasing stiffness on the reactive mass on the contralateral side. If she can continue to perform with the mass and the reactive mass either goes away or doesn't worsen, fine. But if she ends up singing and gets a fibrotic nodule with indented scar opposite the existing scar, the surgical results are likely to be worse, in my opinion, and you're likely to end up having to operate on both sides. You have scar on one side and pretty normal vibration on the other side, or even a little soft mass on the contralateral side to help fill in the deficit. You do all right. If you have bilateral opposing scar, that's not good. So that's what I follow long term if we let somebody keep the masses. I'd be interested to hear how everybody
And
else
how long,
manages.
Dr. Satalov, how long would you wait for the resolution, the
If I-
surgical resolution?
If they get through therapy and we decide they don't need the masses removed for their purposes and I let them sing, I look at them every 2 to 3 months, almost forever, long term.
And having concerts?
And I keep them coming back with the voice team, even if it's only once every 6 to 12 weeks. Not only because it gives them a refresher, but because they know if the voice team is going to be looking at them, they are more apt to remember and practice because they know they're going to be seen. I think just making the appointment helps compliance.